The next session is the one that I personally really enjoyed and really anticipated. So before ChatGPT captured the world's attention earlier 2023, AI has actually been a long-time transformative force in enterprise and industry. The emergence of generative AI now poses the question, how does it alter the landscape? What unique opportunities and challenges does it present for large organizations affecting millions of employees, customers, and other stakeholders? Today, we're very privileged to welcome two distinguished speakers who are at the forefront of enterprise AI. Firstly, we'll hear from Jim Swanson, Executive Vice President and Chief Information Officer at Johnson & Johnson, a key member of Johnson & Johnson's executive committee. Jim is a pioneer in harnessing technology innovation to enhance business outcomes, foster organizational change, and advance human health. Leading a global team of over 4,000 technology professionals across 50 countries, Jim led his team merge deep scientific knowledge with cutting-edge digital solutions. Spearheading a digital ecosystem seamlessly connects J&J's 130,000 colleagues to patients and customers worldwide. Jim and the organizations he has led have received industry claims for their contributions in leadership, best places to work in IT, and support of STEM for emerging talents. Following Jim's lecture, we'll transition into a Q&A session led by Josh Kampel, CEO of Wars Media Group, where Josh oversees the strategic and editorial direction at Wars. As a serial tech and media entrepreneur, Josh served as the CEO of Techonomy Media, which was sold to the holding company of Wars in 2018. Under his leadership, Techonomy became a leading voice on the impact of technology on business and society. Prior to that, Josh was the chief marketing officer of Transactis, an electronic billing and payments fintech company that was sold to MasterCard. Drawing on his extensive background at the intersection of technology and business, complemented by insights from his recent visit to Davos, Josh will bring us a unique perspective to today's discussion. Let's welcome him on stage.
Thanks, Jack. Good morning. We're still in the morning. I'm really excited to be here. So, as Jack had said, I'm the CEO for Johnson & Johnson. For those that don't know Johnson & Johnson, we're the largest integrated healthcare company in the world. We have over 100,000 employees worldwide. We have we used to have three. We now have two major sectors. We divested our consumer health business, and that's a separate company called Kenvue. Our two major sectors are pharmaceuticals. So we have leading products in areas of oncology, immunology, neurology, cardiovascular. And then our medtech business. We have franchises in vision, orthopedics, cardiovascular, general surgery. And so collectively, we support and serve millions of patients all around the world. And it's a true honor to be here with you today. It's an honor to represent J&J and our journey on AI that I hope to give you kind of an enterprise lens of how we're actually applying AI in the company, and also more than just the technology, how we have to think about it responsibly. You've heard a lot of speakers talk about that already, how we have to think about governance, how we have to think about acceptable use, and the watch out for things like bias and others to make sure as a company, as an enterprise, we're serving our patients in an appropriate and effective way to realize and maximize health outcomes, which is really what our mission is, to transform healthcare. So I'd like to start with kind of an analogy. I just debated whether to use a tree analogy or an iceberg. And so you all know the analogy with an iceberg. You see the top, it might be the model, but there's a whole bunch of things underneath it that make it work. I thought that was a little bit of a negative metaphor. I thought I'd go with the tree. Because within there, you need deep roots in the tree to really make AI scalable and usable. But you want to have outcomes that's your focus. It's not technology for technology's sake. It's actually outcomes driven that actually then drives technology and data and approaches you take. So our outcomes will be inclusive of transforming and improving patient care, It could be financial, so things like revenue lift for the company or productivity. It could be ensuring our supply chain meets the needs of our patients all around the world, so you create resiliency in your supply chain because we're a global company. It could be around talent and people, the outcomes you're trying to drive. So those are the outcomes we always anchor in. And then we look underneath, how do we make sure all the elements underneath it will sustain those outcomes? And you see some examples there, whether that be the models themselves and the algorithms or the environments that our data scientists work in, the digital core, and I'll talk a little bit about that, so that kind of tech stack, Rob highlighted that as well. What we do with our talent and upskilling our organization. Because if you do not upskill your organization, you cannot consume these services. You also have to be able to understand what is marketing and hype versus real and substantive. And if you don't build those skills in your company, in your organization, you'll chase a lot of shiny objects and not get the value and can actually hurt your company. And areas also, governance, risk, and ethics, which I've already highlighted. It's absolutely key and critical as we think about these foundational elements to then drive the future of our company or business, in our case, for our mission of transforming healthcare. So let me start with kind of the outcomes first. What are the things we're driving towards, of which a number of technologies enable? It's not just generative AI. We've been doing AI for a number of years, traditional regression-based models, machine learning-based models, natural language processing-based models. So we're building on a base of technology and understanding adopted by our business colleagues that we're using to drive outcomes for patients. So some examples across our enterprise. R&D. We're using machine learning models to take a large set of data that we have and better identify what's called a new molecular entity. That is the compound or molecule that we use to then bring that into clinical trials and hopefully bring it to market. We do a lot of effort to discover those molecules. We use machine learning to accelerate that insight generation and to get to molecule discovery. We have 2 molecules, one in oncology, one in immunology, that were directly accelerated through the use of machine learning and machine models. Let's take our clinical space. It's really important in our clinical trials that we represent the diverse populations of patients we serve around the world. So if we have data sets or clinical patients that are not diverse, meaning they're a certain ethnicity or age group, we do not get the fair representation of what that molecule is doing in the broader patient population. So we actually use AI today to determine, is our clinical trials and the patient populations that are in it diverse enough to represent the global patients that we're serving. And so we've been able to identify, we've even created an application that looks at the diversity of our clinical trials based on the patients that have entered, and we find principal investigators that monitor and run our trials that actually have diverse patient populations that represent all the patients that we leverage. So we have a real goal in making sure we meet the needs of every patient around the world. It has to be representative in our data and our clinical studies, so we use AI to help enable that. If we think about our commercial space, we're using AI today to do something that's called next best action. So we have years of healthcare professional interaction data, whether it be an orthopedic surgeon, whether it be an oncologist, whether it be a general practitioner, using that data and insight to apply models to say, can we actually improve the understanding of our products? Can we actually improve new patients enrolled that have that need? And can we demonstrate the value of that in an outcomes-based model that says, the models are highly correlated to that outcome. And what we measure in that space is new patient enrollments. And we've seen an uptick of high single-digit to low double-digit increases in new patient enrollments across a number of key brands that allows us to better support and get the medicines to patients that need it. But it also helps us continue to grow those products so we can then reinvest that into R&D. So we're using those models today to invest in those technologies and have the outcome. And now we've learned a tremendous amount in that space. Now we've moved it upward of the life cycle where we look at things like product launches. So being able to use models to inform product launches and, again, hit the most patients that we can cover. Customer experiences, we use augmented reality with our orthopedic surgeons to be able to use that to train them on procedures. Augmented reality coupled with AI. And what we've seen is a 280% increase in our ability to train those surgeons over traditional methods. And we've seen a significant increase in patient outcomes because they're doing this in silico. And we have things like navigation systems tied to our robotic platforms that helps guide a surgeon through a procedure so they can actually be more effective. The outcomes for the patients are better, and they're actually better trained in how to use those procedures or those devices in a more effective way. Things like supply chain. We use models today to be able to determine our supply chain utilization of our products. And so if we can reduce our safety stock so it's appropriate That's impact the cost of goods. But it's making sure the products are where they need to be, and we tie that capability into the hospital setting so we can actually read what devices they're using, what medical kits, and we can enhance our ability to have the right data sets or the right products to the right surgeons at the right time. So it changes the way we operate our supply chain, which also changes the way we interact with our healthcare professionals, and they're more pleased with working with us because they know the product's going to be there when we need it, and we have the data and the models that best support it. Things like HR. Using models that we use today to grow our talent. In my own organization, we use inference models to determine the skills and competencies of what I call future-ready skills for the corporation. So I've declared 40 technical skills, I declared about 10 soft skills, think about agile, customer journey mapping, and half a dozen leadership skills. We use inference models tied to real-world data that we have, determine the competencies of my organization in those skill sets, and then use that to drive training programs to advance those skills. We've now applied those models in career learning journeys for the whole organization. 130,000 employees go to our platform called JJ Learn. We're a learning company. And how do we build the competencies and skills in every part of the organization? The number one program of 130,000 employees is building digital acumen. Really critical. You've heard a number of speakers talk about embedding those skills. We call them bilingual skills. If you're a lawyer, if you're a procurement professional, if you're an R&D scientist, a commercial leader, a supply chain engineer, you have great domain expertise. We now have to couple that with digital expertise and use that to reimagine, you heard that also from the speakers, your processes, not just incrementally improve. If you don't couple those skills together, you never get the reimagination. So that's been a big effort we've had and a journey we've been on at J&J, and we're continuing to progress that across the whole company. We call ourselves a learning company, and we hire knowledge workers that want to continually learn. Really key in how we think about embedding that. And the last example I'll highlight is finance. We spent a lot of time to actually modernize our financial data and systems. We have 99% accuracy in the data that we use to be able to use that for forecasting. We spent some time in our data in a big way. Now we can actually predict our forecast model for revenue and sales. We've improved by 1% to 2%. So, okay, 1% to 2%. Why is that really a big deal? We're a $90 billion company. That's a swing of $1 billion to $1.5 billion. That's material. So actually using that into our core process, now reimagine how we're doing those processes. And if we have early access to forecasting, we can then adjust processes in our own company to better support the financial returns we want to realize. I went the wrong way, sorry. So this is some of the examples. Rob covered a bit of the tech stack, so I don't need to drain it, but it is really important that we think about this tech stack because without it, you can't scale. So we think about our infrastructure and cybersecurity. Do you have scalable, elastic compute that's highly secure with what we're trying to apply for? So that's an important foundation that we have. Data. Super critical that we're taking data that we have and we're using that data in the right way so that we can actually apply that to some of the examples that I gave. And so we have clinical trial data, we have research data, we have financial data, we have supply chain transactional data. That data has to be made available to those models for the outcomes we're trying to drive. The models themselves and the environments, to build those models and embed them and continually mature them. So we have all kinds of models, generative AI models, large language models, regression-based models, machine learning models, natural language processing models. We're not picking a technology for technology. We go back to the use case, the outcome. What's the appropriate technology, appropriate data that we need, the appropriate models that we need, because then it allows us to focus on what's most appropriate to drive the outcome. And then the top of that stack is that customer interaction, whether it be employees or externals. No model is going to be scalable unless it's embedded in somebody's workflow. So we spend a fair bit of time to embed the model and data in somebody's workflow. So if you're a financial analyst in our company, the model's embedded in the tools you use to do the forecasting. Because they're not going to go separately. Let me go call the data scientist to go call the model to see if the forecast is right. It's got to be embedded in how they work. And so that's also part of the things we look for, what we build internally, what we work with our technical partners on, and embedding that into the workflow so it actually gets consumed and used, and it becomes a feedback loop that we can iterate on and evolve it. There's been a lot of talk around looking at the risks as well for AI. I did a presentation to our EC early last year, and I said, I walked them through a generative AI 101 primer so they can understand it as business leaders, they can apply it to the core business, but I also said, here are the risks. Hallucination, biasness, do you have data that's valid? Do you have the governance process in place to check what's an appropriate use case? If you take employee data and you're using that to then better select an individual for a job, do employees know you're doing that? And do they have an issue? Well, the answer, yes, they have an issue, unless you're describing what you're doing, how you're doing it. So you have to have the governance in place. Within that meeting, after about 3 hours of going through it with them, I said, this is a space we have to be in. We cannot avoid it. We have to actually lean into it. We have to do it in the right way. Within a month, we had a governance policy, a governance group. We published to the whole company, 130,000 employees, appropriate ways they can use generative AI. That was signed by myself, our chief risk officer, and our general counsel. And then we have 300 use cases we're applying to this governance model across all aspects of our business to improve productivity, to learn. Everybody's still learning in this space, but then appropriately apply it. But we're also working with external agencies and influencing policy. We're working with tech providers on making sure they can indemnify their models. If they're not, don't come to me with it because you haven't done the homework yourself. Looking at biasness in the data, a number of things we're working through. Even what we did recently with the OECD, the Organization for Economic and Corporate Development, really describing why this is important in healthcare, which is a little bit different than large tech companies looking at ad clicks. We want to actually look at the segment of healthcare and make sure we've got appropriate use of the information and data, but we're talking about patient and patient impact. That should have its own kind of view to make sure that's managed well, but being applied into the core of healthcare. And there was a good study by McKinsey recently that highlighted that over the next year or two or few years, they envision that it's going to be $60 to $110 billion of value annually created across the healthcare sector and applying AI and technologies to improve healthcare and outcomes. So there's a tremendous opportunity, but you have to understand the risks, the areas to avoid, and we've even published, and there's a QR code you can click on, our ethical policy publicly, transparently, how we think about data, how we inform about models, where we're using it, where we're not, how we check for accuracy information, and there's always, always, always a human in the middle. Absolutely critical. So even though the model generated it, there is someone in the middle that's accountable. We don't point to the model. The individual is accountable to the results and the outcomes, and as an organization, we live into that with our governance, for continually assessing the quality of our outcomes, and then driving that into core business areas where it makes sense. I highlighted, I highlighted some of the things we're doing around learning and training. So we have 130,000 employees. We've had 65,000 employees or 62,000 employees take our generative AI training. You have to take it in order to use it. We've created a secure stack for generative AI. We've created a way to actually model it internally. We only use our internal curated data that's highly validated already, and we use that to apply to different problems, but you can't do any of it unless you take the training first. We were 6,000 data scientists and digital employees that are helping to drive and build the expertise and competency to be able to leverage it. I love my tech company partners, but I can tell you there's not a tech company on the planet right now that says they're not an AI company. 90% of it's marketing, 10% of it's substance. And I know because I'm a consumer of those services and I know what's real and what's not. And even when you look at market capitalization of those companies, if they don't say they're an AI company, the market capitalization doesn't stay flat, it actually goes down. But you got to know the difference. And you also have to know it's a very emerging technology, generative AI. There's a lot to learn. But traditional AI has gotten more legs under it, but generative AI will get there as well. And so don't follow into the hype curve. And I did a presentation to our board recently, and I started with the hype curve. I said, if we follow all the shiny objects, we're having this board meeting today, where we should be right now is we should all be in the metaverse and we should all be avatars. Metaverse is going to have a play. We use augmented reality. I gave one example of that. But you got to use it for appropriate use. And you got to see where it is technically and the use case and the outcomes you want to drive and the risk. But you got to be investing in those areas because as Rob really well pointed out, the GDP of companies is based on technology. When we transform healthcare, we got 3 pillars. Science and innovation, because if we don't have those things, we don't exist as a company to invent for healthcare. Second, amazing talent. Without the talent across all disciplines, we can't be successful. Third is technology. Those are the 3 pillars we need to have, and that's why we're doing the training, and that's why we have created something called high-performing teams. For every problem we're trying to address, significant transformation of the company, there's a high-performing team wrapped around it. It has legal, it has procurement, it has finance, it has technology, it has commercial, it has R&D. The appropriate skills and resources together to solve that problem, because every one of those roles has a lens and a perspective, and collectively, we get to a better outcome as a result. And as I said, we're training 130,000 employees. It's actually one of my pillars of my strategic agenda. I have 3 of them: modernizing the tech ecosystem, building the digital acumen of 130,000 employees, and then accelerating innovation for impact. If we don't upskill 130,000 employees, we do not transform anything. We don't transform our company. We can't reimagine the business. So it's a key element of our company. And we actually have J&J Learn Days where the whole company spends a day on learning. We build content that's relevant to each role and domain and creating bilingual employees that could take their amazing domain expertise coupled with how do I leverage technology or data appropriate for my use and purpose. So last slide, and then we'll get into the question Q&A section, is we've got to continue to think about the future. You need all those elements to drive the outcomes for your business. You have to be really clear on the mission you're trying to achieve. You're really clear on OKRs, objectives and key results you're going after. You have to have the right talented people in place with the right governance, the right process. You also have to be adaptive and iterative because things are changing. What we know today is very different than we knew even 6 months ago. You know, when I talk about using large language models, we don't just use one. We're experimenting OpenAI, Lambda, Palm. We're using different cloud platforms because they have different aspects we want to leverage. We also use small language models for things like protein folding that are specific, so 2 billion parameters, not 100 billion, but targeted for protein identification and molecule selection. So we're using the broad gambit of capabilities across the company, but we're always learning, we're always evolving, we're always partnering to get better because the mission is too important not to take advantage of that technology, but you got to do it in the right way. So that was my opening remarks. I'm going to invite Josh, and we'll have the Q&A.
Thanks, Jim. So I do want to take a step back in your role, because the role of the CIO, traditionally, people think about IT, they think about infrastructure. What you just outlined is really at the core of driving business growth, as Rob talked about, and innovation. Having a seat at the table, Joaquin, your CEO, had your role, right, the interim CIO role before he was made CEO. So talk about how important it is to have that seat at the table as J&J looks to move forward, and what could other organization and enterprise understand when they have a CTO or a CIO or a chief innovation officer, you know, what role that plays in strategy versus just implementing a strategy built by an exco?
Well, I think there's a number of speakers that highlighted how you view your IT function. Is it the old way, their operational, their productivity, say, their efficiency? Nothing wrong with that. That's part of the function. It never goes away. But if that's how you position it, that's all you're ever going to get. If you are actually at the table to shape the thinking, it's a big differentiator. Are you at the table for the crucial conversations of where the company's going? I mentioned it highlights J&J mission to transform the trajectory of healthcare. Not incrementally improve it, not just provide great products, to transform it. If you then unpack that word transform and the area, in my case, healthcare, what does it take to do that? It takes amazing science and innovation, it takes amazing talent, it takes amazing technology. So if that's one of your pillars, how do you not have the CIO at the table to help describe that? But I look at myself as a business leader that knows technology, not the other way around. If you're a finance person, a legal person, and you're at this table, you're a business person that knows legal or knows finance. You're giving a perspective that only you have, but your job is not just that domain. You got to think about it holistically for your company, and how do you integrate it into the solution? That's why I started with the outcomes. Those outcomes require all of that to be successful, not just one piece of it. And I just worry about my piece, you never get there. So it's that connected view. And I will say, when I talking to our general counsel, recently retired, I said, I'm the first CIO, when I came back to J&J, that you had at the EC. J&J is a smart company. How is that not possible? That wasn't there before. And he thought about it, and he responded in a very thoughtful way. He said 2 reasons. One, we didn't know. So all the technologies in the organizations, if you're not explaining what technology can do, that's on you. The second thing he said, we didn't have the right person. They were looking for the right person that could balance the business outcomes and business needs and then translate it into the technology, not the other way around. So I ask you, in your roles as business leaders and others, how do you embrace these core competencies of skills? How do you embrace people that have that domain, but push on them to drive outcomes, not just drive implementation of projects?
So, we've heard a lot about risk. Sebastian was up here. Legal is now a big part of as we deploy technology in organizations. Talk a little about the process from pilot to scale, right? A lot of companies get caught in a numerous number of technology pilots that never get scaled through the organization. A lot of times they run up against roadblocks and barriers from legal, from risk. Just talk about how you get the buy-in, but also from a standpoint of taking something from, hey, we're going to try it in this little sandbox over here before we scale it to the massive organization, and how you could actually push that through to full scale.
Yeah, it's a great question. So I've been doing this job a long time. I started as a bench scientist, actually. So I did my undergrad in biology and genetics, and then went back to school and switched to computer science and did a master's in computer science. And over those 30 some odd years, I guess I'm dating myself now, I've seen so many. Let me show you my digital product. I was in one company, I was living in Germany, and I first started there. I said, we got 100 different digital products that we're excited about. Great. I was sitting next to the CFO. Both of us wrote the same thing. Can any of these scale? Does any of these material for us? So just doing efforts is not working. You have to start with prioritization. What's the outcome you want to drive? And then go after what are the efforts that make sense. So we take an example that we had. So we're all experimenting with generative AI. It's also built on, we've got a lot of knowledge of using AI and ML. So we created sandboxes for generative AI that's secure. We then provided use cases that we think are really accretive. I'll give you an example. And if you're a sales rep in our company, you have to know a lot around the products that we provide. So we have one called Tremfya. It's an immunology space. There's a lot of details as a sales rep you need to know in order to position that product in the right way. There's a lot of regulations. For example, you can't do off-label use of that product that's not on the label. So training a sales rep to make sure they position the product right based on the allowed legal material takes a long time to learn. So what we've done is we've taken our curated content, we put it through our internal ChatGPT interface. This one's happened to using one of the large language models, and it allows them to accelerate their learning, and that we find, because it's curated content, that's highly accurate. So if we see more of that, we have the scalable infrastructure I talked about. We have the regulations in place and the policies to then scale it more broadly. If it didn't work, we always have a human in the middle. This is not accurate. And so what do we need to do to iterate? So we take that approach to test and learn. We've done some similar things with quantum computing. We've done things with augmented reality. We take this same model of integrated teams, a business problem to solve, iterate on the learnings, have a scalable environment that if it does work, we scale. If it doesn't work, we take that learning, and then what do we need to do better to make it available? In some cases, hey, the technology's not ready. You don't use it. But you don't know until you leverage it. So that is a continual process we work through, whether it be generative AI or any tech that we're talking about, that is really accretive for how we scale and apply.
So in a minute, I'm going to go to questions. So please, I think we'll only have time for one or two questions. But on that learning, right? We talked about cross-industry learning. Every industry thinks they're so unique, right? Healthcare says, oh, we're so unique because privacy are on our data. Financial services said they're unique. You spent years in ag before coming back into into J&J. Talk a little about how organizations should be sharing cross-industry and the learning that could happen versus being entrenched in a singular industry, looking at what your competitors or your partners are doing, and how we could think about as industry professionals here exchanging, our learnings.
I think it's super critical. I left healthcare, as Josh highlighted, for a couple of years to go into big ag. I'm a very mission-driven person, so healthcare is a big mission for me. Feeding the world sustainably is a big mission for me, so I love those kind of industries. By stepping out of healthcare and going to ag, I actually saw more technology in agriculture than I ever saw in healthcare, which astounded me because the investment in healthcare is 10x. But how they were collecting information on the field, how are they using hyperlocal weather monitoring to better predict environment variables, how we were connecting information off the supply chain to make sure that small agriholders in India could go from sustenance farming to profitable farming. Seeing how data came together in really effective ways to improve outcomes and yield while reducing input costs, which was more sustainable and more profitable for the growers, and then more effective for consumers that were purchasing those products. So taking that learning and coming back to healthcare, there was so much I learned by applying that knowledge, by seeing it from a different lens. I have a great CIO network of major companies, JP Chase, FedEx, Boeing, Amex, big insurance company. I learned a ton about how they tackle those problems, and then I could translate, wow, that could work in healthcare. I hadn't thought about that. I have good colleagues and friends with Lori Beer. She's the CEO for JP Chase. Financial services has done a lot in the technology space. It's a very different industry, but we're both regulated. How they apply technology in effective ways, I can take that learning and translate it into healthcare and accelerate my ability to deliver for patients, which is really great. And I share with them what we're doing, and it works the same way. They actually accelerate what they're doing by learning from us. So building that ecosystem of diverse talent, diverse domains, it's invaluable. It's critical. If you want to be successful in business and you don't do that, you won't be. Trust me. You need that coming together, and you got to be bilingual. You got to build those skills more than just your domain to be successful for the future.
So we have time for one quick question. I know there's Mike running somewhere here. We have a question right up here.
Thank you. Great presentation. You gave a master class on how to deal with AI, so that's great. My quick question is, you mentioned that there's always a human in the loop, but there's so many models, thousands of models doing so many different things. There's no way even 130,000 people can monitor all these outcomes. What kind of guardrails do you have that will automatically tell your management or whoever's in charge that, hey, these models are going to eventually degrade, are going to be monitored?
Yeah, so that's a great question. So we actually, if you think about the traditional AI and ML space, we've actually created kind of a production and looking at those. So it's not just deploy the model. For those that are in technology, you know DevOps. It's kind of ML ops. So you're constantly looking at, over time, is there model drift? Is the accuracy still there? Is it highly correlated to the outcomes you want to do? Has the data changed? So even in our transparency report, you could see these are elements that we look at constantly to make sure that we're still aligned to the outcomes we see. And you have to really treat it like anything else. It's a production-based capability you're constantly monitoring. And then you're always learning. So there's maybe some things you missed. The data is a new data feed that's different where it was before. Do we understand there's a biasness? So you're constantly iterating on that. In the case of generative AI, what I heard a stat, there's about 200 some odd maybe LLMs and SLMs right now. That's going to continue to grow. But we know it takes a lot of money to actually build an LLM. All your companies aren't going to tomorrow become creating LLMs. It's not going to happen. At least with the way that it works today. Too much compute resource, too much investment. What you do need to do is you have to understand things like prompt engineering. You have to understand things like RAG, retrieval augmented generation. You have to look at the data that you have. And what we've actually done is we created sandboxes on a subset of large language models that we're monitoring. So we have PaLM, we have Lambda, we have OpenAI, we have small language models like the protein one I mentioned that was specific. So we're actually requiring our employees, these are the models you got to use, because it's still emerging technology. But we first want to see the use case. We start there. If that use case isn't valid, don't even waste our time. And we've also seen a lot of characterization and grouping. We've seen over 300 use cases, but I can fit 50 of them in document interpretation. I could see 30 of them in helping to educate people on new regulations. So there's classes of use cases you can couple together. So you do half a dozen based on different categories, and you've actually proved or disproved the point based on the area. In areas such as HR data, we're obviously much more sensitive. And so we do things like role-based access to certain models. If you're in HR and it's an ER-LR, employee relation, labor relations item, you could see this subset, nobody else can. And so we're really being thoughtful, but it's still early. We have not necessarily gone prime time, except for our internal ChatGPT that kind of exposes people with things in a secure way with the data they can provide. But constantly governing and monitoring. And as it scales, as it matures, we already have the engine to apply that in the right way. But I can tell you it's still very early, and we understand that. And so we're really cautious, but we're still applying it because there's too much to lose if you're not learning and using it.
Well, let's give a round of applause to Jim. I know he'll be here through the day, so if people have additional questions.
Thanks, Josh.